Okay, this video is going to be visually pretty boring, but it's going to basically be an explanation of sort of during the COVID stuff, how the attitude to masks completely changed in the media and sort of through medical advice. So obviously, to begin with, everybody was told that there was absolutely no need to wear masks. Wearing masks might make things worse. And the idea was that most of the advice being given was telling regular people not to get masks. Now, some of that could have been completely wrong, and some of it might have been being done basically because lots of governments hadn't prepared properly, didn't have enough PPE, personal protective equipment for medical staff and things like that. So they were basically lying at that point or being very cynical, saying, to the public, masks don't protect you because, we want to acquire a stock of masks and we're worried about, supply and demand if we say that masks are effective. So that shouldn't be the way it's done. But obviously, over time, with the COVID stuff going on, more and more governments and countries, and health advisory boards have actually said, yes, masks are useful because we knew they were useful for, preventing the spread of infections for a lot of things. But, there's still kind of problem, I think, with the media where they don't accurately report on what masks do what. So the problem is with a lot of media coverage is they essentially will say, not all media coverage obviously, but a lot of them will say, a cloth mask like this, which isn't too bad, for at least slowing the spread of an infection, as in it's basically like having a tissue in front of your face all the time. So, coughs and sneezes struggle to get through it. They basically equate something like this with the exact same level of protection as like a P3, P100 mask, half face mask or full face mask or whatever. Whereas obviously in reality this doesn't really filter out anything. It gives you a very limited amount of protection because obviously the material does filter particulates out to a degree, but the main feature of those masks is basically, as I said, it's just if you're coughing or sneezing or breathing, heavily, it's, lowers the amount of particles, viral particles you're putting out into the air around you because a lot of it's getting caught in the mask. So, that's what that does. So if everybody was wearing one of those, as simple as they are, it would cut, infectious disease sort of rates down. However, if everybody was wearing a mask like this, they wouldn't get COVID in the first place, at least through inhalation, or the probability that they would be very, very low. Now, obviously, in an ideal world, I'd like to see more masks where they have a filtered output as well as a filtered intake, So you've got your, obviously, particle filters where the air comes in, but obviously there where the air comes out, it's just the standard exhale valve. So it'd be nice if more companies did something, like a medical style N95, mask over the exhale valve, just so, it works both ways. But there's been some quite interesting studies you can find quite easily, and Dr. John Campbell talks about them a lot in his videos, where, the amount of deaths and infections that would be lowered if everybody wore a mask rather than saying, oh, I'm exempt for medical reasons, where only a very small minority of people actually are exempt. A lot of people are sort of doing the thing of, I don't want an inconvenience of wearing a mask. So they don't wear them. But yeah, so I just thought it was kind of interesting, how to begin with, all of the authorities that are now, insisting in lots of countries everybody has to wear a mask for, like legal reasons or you can be fined, were saying to begin with they didn't work. And I think this has been a lot of the problem during all of the coronavirus stuff, is a lot of the sort of, politicians for obvious reasons didn't want to listen to the scientists and people that actually knew what they were talking about. They'd rather have, tried to make up the stuff as they went along. So, because they hadn't got enough PPE for doctors, the stuff wasn't useful, It didn't matter. They hadn't ordered PPE for doctors because that was a waste of money. And then, as soon as they got it in, oh yeah, it's the best stuff ever. Look at how good a job we're doing. We've ordered this many million units of PPE when, each of those units they might have been counting a single glove from a set of two gloves or whatever it was. So yeah, at least maybe what we'll learn from COVID is that maybe, because in a lot of Asian countries, it's very common for people to wear sort of masks like this if they're out and about, to stop the spread of infections or slow down the spread of infections. Maybe in Western countries we'll learn to do that a bit more, maybe it'll become a bit more socially acceptable. Because one of the interesting things, at least, is apparently far less people got the common cold and flu during this sort of period with coronavirus compared to a normal period of coronavirus, like normal period of the year for the same months, just because lots of people were following better hygiene. But sadly, there's still a lot of people that can be super spreaders and ruin it for everybody. So yeah, as I said, short and simple video. Sorry for the boring visuals. You've had two masks to look at essentially, but it was just one I wanted to make the point on, that it's kind of funny, isn't it? How lots of official sort of government advice changes depending on the situation the politicians are in, not actually based on scientific fact. But, I'm glad we've at least got to the stage now where lots of, media outlets and governments have acknowledged that, masks like this do something, as opposed to it's actually more dangerous to have a mask like this than not have one. I think the weirdest one I've still heard that some of the anti-maskers say is that if you wear one of these too long, it gives you brain damage or something because there's not enough oxygen getting into your lungs. Like, that's just ludicrous, isn't it? But, oh well.